I want to tell you a little bit about what I think is good about the rural regional programs. So I'm a little bit biased, so I'm probably the person in the past who said that rural is more hands-on. Nelson is fighting back against that. So why choose rural regional? So I think there's but more opportunities in comprehensive medicine. So the community physicians tend to have quite a broad-ranging practice. So each physician working in a lot of different settings and doing a lot of different things. So I think that gives you the opportunity to have that education and to sort of see the breadth of practice that you could have when you're out. So I think that's important. There are more hands-on procedural experiences. The rural regional sites, most of the physicians will do emerge, or while you're there will participate in family medicine OB, and so you'll be a part of that. In the smaller communities, there tends to be fewer number of students, so it's more you're first line. You're there. You're doing the procedures. It's not that you're in London Emerge with 8 other residents and you're all sort of vying for the fractures or the intubations. You're the students that's there, so whatever comes in the door, you're getting to do. So I think that you have that opportunity to do a lot more procedural things. As well, you get a lot more one-on-one teaching opportunities because of that as well. And as well, a lot of the smaller rural sites have 1 student to 5 preceptors, or to several preceptors. So instead of the students outnumbering the preceptors, they're there sort of for you, for teaching, to be there for support, for all those types of things. There's also exposure to more acute care. The hospital inpatients that you do tends to be more acute. Often the community hospitals are family-run hospitals, so it's not that patients are admitted to internal medicine and the internal residents are seeing them. They are on the floor, but it's family docs who are looking after them. So you're seeing, the non-STEMIs, you're seeing the acute COPD exacerbations. It's not when they've sort of settled down and internal thinks they're good and then you get to look after them. You're looking after them in sort of the acute stage. Often even sort of in the emerge, because a lot of them are family docs who are working in the emerge and you're working with them. You're deciding who gets admitted. You're deciding what the acute treatment is. So you're often actually admitting the patient and then seeing them the next day and seeing how what you've done is making them better, or if it's not working, how you need to change it. So you have that sort of continuity where you can actually see the benefits that you're giving to your patients. There's also more elective time. It varies depending on site, whether it's elective selective block time, so sort of 4 weeks at a time, or whether it's a longitudinal. But in general, even on the longitudinal sites, you, with your preceptor, are helping to decide what your curriculum needs to be. So you're deciding whether you need more enrichments in general surgery or enrichments in plastics or obstetrics, or working with a psychiatrist. So you have a really pivotal role in deciding what your educational needs are and how you're going to get those. So there is quite a bit of flexibility in elective time throughout the rural regional. So it'll be good when it comes to the interview day, because there'll be sort of each site and there'll be residents and faculty that you can talk to. Because we're so broad-ranging in the sort of rural regional, it'll be a little bit daunting with all the details. So please really come talk to us. When you have questions, it'll make a little bit more sense than sort of the slides that we'll just sort of whip through. So the London Regional Program is considered Mount Bridges, which is the Southwest Health Centre where I work, Strathroy and Ilderton. So they're all sites that are within commutable distance from London. So often residents can live in London and then commute out to these sites. Occasionally there are residents though that really want to be immersed in the community that they are. So we do have some residents who actually live in Strathroy and sort of get to experience with the London Regional program, there is an internal match that happens after CARMS. So if you do match the London Regional, you'll be going to either Mount Bridges, Strathroy, or Ilderton, but you won't necessarily on match day know which place you're going. The curriculum is a little bit different between Mount Bridges and Strathroy and Ilderton. Mount Bridges and Strathroy have the same curriculum where you'll have 16 weeks of family medicine in first and second year, 28 weeks elective, and 8 weeks of selective. So you have quite a bit of flexibility there to get the training that you need. Often you can sort of set things up to get you going to where you want to go in your career. So I work emerge, but I didn't want to do a 2+1 year, and you don't, in smaller communities you don't have to. So I was able to set up with my elective and selective time, I was able to set up for the rotations that I would need to prepare me for that. So ICU, extra emerge, peds emerge, all those kind of things to prepare me to be able to do that. So there's a lot of that availability. Ilderton in first year is similar to Mount Bridges and Strathroy, but in second year is more of a longitudinal curriculum. So you'll spend more time in family medicine, but with horizontal enrichments with various specialists that you'll be able to, with your preceptor, decide what will be best for you. But then there's still quite a bit, 24 weeks of elective time, which is still sort of significant for you to supplement if there is sort of a concentrated experience that you want. This sort of a map showing the other locations. Some of them are considered rural, some of them are more sort of regional sites. So Hanover, up at the top of the page, Goderich by the Lake, Patrol, these are all just sort of pictures of the various sites. Just to go over a little bit, touch on the curriculum of the places, because it sometimes can be a bit different. So Chatham, Kent, and Goderich have a similar curriculum. PGI 1, you're 16 weeks of family medicine, and then you'll get 48 weeks of elective time during the first year. And then in second year, it's more of a horizontal, longitudinal time in family medicine. So you're spending most of your time there in the community, working with your family preceptor, but with having a lot of enrichment all through the year. So you're actually getting exposure to all the extra training that you need, but it's sort of spread out through the entire year. There is still the option that if there was something that you felt that you weren't getting, that you needed a dedicated rotation for, that is available as well. Hanover and Petroleum, again, first year is sort of fairly similar, and then PGY2 has a longitudinal time, but it's 32 to 36 weeks, so not quite as long as Goderich and Chatham, Kent, and so that means that you have a little bit more sort of block elective time that you could do. So this is a little bit new for this year. So Stratford and Tavistock, because they both sort of work out of the Stratford General Hospital and are sort of in similar geographical areas, we've actually matched them up this year. So if you match to the Stratford Tavistock program, there'll actually be an internal match after CARMS where it's decided which actual practice you'll work out of. The curriculums are different though, so Tavistock is very similar to the Mount Bridges and Strathroy curriculum, so 16 weeks of family in both first and second year, and then quite a bit of block elective and selective time. If you're in the actual Stratford practice, first year will be very similar to Tavistock, but in the second year you'll have that longitudinal based curriculum. So that's a little bit different, but you'll still have a decent amount of elective time. So I know that's a little bit overwhelming because they're all sort of a little bit different, so please come and talk to us when we have our booth and things are sort of settled and